Today we're celebrating the topping off of the steel infrastructure of the building, and we're celebrating the work we're doing in the human infrastructure.
So signing this beam is fun, but it's also a way to memorialize all of our collective efforts. So for each of you here that signed, you're a part of this, and we appreciate you.
And there's so much stigma around substance use and mental health disorders that it's hard to get treatment. This is going to become a campus of hope for people that are brokenhearted, people that need, that have mental health and substance use disorders, and they're looking for treatment.
Well, that's the entire intent of everything we do at the Huntsman Mental Health Institute. It's to create the new prototypes, to create the new models. And so we're not just building a clinical building, but we're building a building that's designed for research. So we create new models and approaches to care for people who are in crisis. It's designed for training so that we can train all types of mental health professionals, from peer support counselors to social workers to nurses to PAs to physicians and psychologists. No one's ever built a building like this before.
We'll have the front door access for the general public, you and I bringing family members, and if law enforcement picks somebody up, here they will be able to check them in, sign them in at the back door in a secure entrance, and be able to get back on the streets and do the work that's so badly needed with our law enforcement.
We're going to continue to need to invest in this community, again, to keep us day in and day out the incredible community we are. And if we don't continue to invest in mental health, substance use, trauma, domestic violence, and other social services needs, our aging population, we're not going to remain who we are.
We were asked as a family if we could support a new mental health crisis center situated between the jail and the homeless shelter to try to help 18 and older, first solving their mental health issues and then lining them up with resources to make them productive in the community. And the Huntsmans were very grateful for the support, and they asked, and it was embarrassing, if they could use Carolyn and my names on the building. It's exciting what the Huntsmans are doing and how they're helping, and I'm just grateful that we could be a small part of it.
This is a success because this is a unique public-private academic institution partnership. When we all come together as we have with this project, we will do incredible things.
We live in an environment that doesn't exist in most of this country or most of the world, where people of means are actually partnering with the state and with the county and with the city to take care of those in greatest distress and need. We have a unique environment here, and one that allows us to set the standard for the rest of our country.
So while I may have signed my name on maybe 150 buildings, I've never signed my name on one that was as important to me. This really means a lot to get started on mental health in our community.
Mental health is behind every single door, and we're just not talking about it. And our goal is in the next 10 years to eradicate the stigma, because that's the number one reason people do not get help. And so if we can eradicate the stigma and let people have dignity, and that our mental health just becomes our regular health, because that affects every single emotion. When our heart is broken and our brain is broken, it affects every single relationship that we have and how we deal with life. So if we can fix our brain and fix our heart and just love and no judgment, we're just going to live in a better space.